Alright, in Chapter 12, we're going to be looking at pharmacology and how it applies at the advanced AEMT level. So it applies to patient assessment and management fundamental knowledge of the medications carried by an advanced AEMT that may be administered to a patient during an emergency. We're going to be looking at several different things: medication safety, kinds of medications used during an emergency, medication legislation, naming, classification, storage, and security, and, autonomic pharmacology, metabolism and excretion, mechanism of action, medication response relationships, and medication interactions and tox. The advanced AEMT administers certain medications and can help patients self-administer other medications. So a drug profile gives all the specifics about a drug. So to include a package insert, it is included on the package insert. It's listed in various pharmaceutical publications also. Pharmacology is the study of properties and the effects of drugs and medications on the body. Drugs, chemical agents used in the diagnosis, treatment, and prevention of disease. And medication is a chemical substance used to prevent disease and relieve pain. A dose is the amount of medication that is given. And doses are given in different units, so you have to keep your units straight also and be able to correlate between those actions, the therapeutic or intended effect of a medication that is expected to have on the body. Unintended effects or effects that are undesirable but pose a little risk to the patient, untoward events, effects, or effects that may be harmful to the patient. Toxicity is the risk of a substance that will pose a health hazard to an individual or an organism. Indications of therapeutic uses for a particular medication, and contraindications are times when you should not give up the medication. So drugs are derived from 4 principal sources. Some of them come from animals, some come from vegetables, plant sources, minerals, and synthetic compounds. What a good amount of them come from synthetically made. So a medication's trade name, maybe the brand name is the brand name from the manufacturer. Proper nouns that begin with a capital letter, and the drug may have more than one trade name depending on how many companies manufacture. So the generic name is usually original chemical name of the medication, big long name that you usually see, and it's usually suggested by first manufacturer and approved by the FDA. All medications licensed for use in the United States are listed using their generic names in the United States Pharmacopeia. The chemical names prescribe precise description of the medication's chemical composition and molecular structure. The official name is the name assigned by the USP, and it's usually the generic name followed by USP. Alright. Prescription medications are distributed by pharmacists according to a physician's order. Over-the-counter medications may be purchased directly without a prescription. However, a lot of times on the back of those, there is directions on how to give those properly. Okay, the prescription medication, you have to have that script. A lot of times those scripts are sent electronically now, so that there will not be any kind of alteration to them, and people trying to get more than what they're actually supposed to, or less, or different strength of it. So, source of drug information, AEMAs, American Medical Association drug evaluation. PDR is what a lot of people use, hospital formulary. The drug inserts themselves that come in with the medication, and of course the internet provides a lot. So you need to become familiar with these resources and field resources, particularly regarding medications encountered in the pre-hospital setting. So, always try to be really familiar with the drugs that you're using in your environment, in your pre-hospital environment, especially on a day-to-day basis. Um, their effects, their side effects, um, and also you need to know what they're used for, what they're not used for. Also, any kind of other interactions they may have with other medications. So, U.S. regulation of pharmaceuticals. Manufacture of pharmaceuticals is subject to a variety of laws and regulations. In the United States, drug standards are published in the USP and the National Formulary. So this is intended to protect the consumers, prohibit manufacturers from making false claims about the benefit of drugs, require manufacturers to publish information about side effects and known potential harmful effects, outline standards for drug manufacturers to ensure that drugs produced by different manufacturers are uniform in strength and purity. So the standards that are published in the USP and National Formulary there's several laws enacted to protect patients from unsafe substances or unscrupulous manufacturers and distributors. So basically, all that stuff is just out there to help protect the consumers from a bunch of people just mixing up stuff and trying to sell it for whatever reason. All this stuff is tested and it's protected. So yeah. Here's some drug-related legislation. You got the Pure Food and Drug Act. This was the first federal drug-related legislation in the United States. It protects the public from foods, medications, and alcoholic beverages that may be mislabeled, poisonous, or otherwise harmful. So you got the Food and Drug Cosmetic Act, which was in 1938, was amended in 52 and 62. It requires the drug makers to label their products indicating warnings about possible side effects. Authorized creation of the FDA. It's mandated with that dangerous drugs could be dispensed only with a prescription. The Harrison Narcotic Act in 1914 is regulated import, manufacture, prescription, and sale of several non-narcotic drugs and cocaine, opium, and their derivatives. It requires precise record keeping about dispensing of controlled drugs. Requires registration of distributors such as pharmacists. Illegal possession and just distribution of controlled drugs could result in fines and imprisonment. All right, then you got the Narcotic Control Act of 56. Increased penalties for violation of Harrison Narcotic Act, make possession of heroin illegal, and outlaw acquisition of transportation of marijuana. In 1970, the Controlled Substances Act, it was comprehensive legislation dealing with narcotic and non-narcotic drugs that have potential for abuse. Specific requirements for registration, procurement, storage, distribution, record keeping for penalties for failure to comply with requirements. Drugs covered are classified in 5 categories or schedules according to their abuse potential. Schedule 1 drugs have the highest abuse potential and propensity for severe drug dependence. Schedule 5 include drugs with the lowest abuse potential. So you can see a list of these schedules, including description and examples, in your book. So please be aware of the laws in your local area and always follow your local protocol. So these are all laws and regulations. The Drug Enforcement Administration does a lot. The DEA does a lot of regulating and making sure that all these drug-related legislations are being followed, even down to the pharmacists themselves and the way they record the distribution of these drugs, especially narcotics. So please be very mindful when you're working around and with these narcotics in the pre-hospital field. Make sure you follow your local policies and procedures on how they are handled and the proper policies to follow. Even with a paramedic, if you're following them with these medications, as far as making sure that all that paperwork's complete. So I know it's not your responsibility to advance AEMT level. It may become your responsibility one time in the near future. However, if you're signing those papers and they're saying that you witnessed such, you need to make sure you understand what you're signing. All right. Federal legislation also focuses on guaranteed standardization of doses. So, standardization assures patients that when they can take a medication with a stated amount of the active ingredient, they will receive that amount of the drug. So, for a drug to carry USP level, amount of active ingredients must be within 95 to 105% of that stated on the label. Government agencies that regulate drugs, the Federal Drug Administration, Food and Drug Administration, Drug Enforcement Administration. So the FDA enforces Food, Drugs, and Cosmetics Act to determine safety and efficacy of drugs before they are allowed to enter the U.S. market. Right. The DEA executes provisions of the Controlled Substances Act and includes registration of physicians who are permitted to dispense controlled substances. Public Health Service regulates biological products, including antitoxins and vaccines. The Federal Trade Commission monitors drug advertising to ensure it is not misleading or inappropriate. It makes recommendations to the FDA regarding direct to consumers advertising. So the drug approval process, commercialization process takes years. So, these drugs go through a lot before they actually put it out there on the market. All new drugs must go through animal studies and clinical trials in humans before approval for distribution. So the average time for a drug to be developed, tested, and approved is about 9 years. So all drugs, animal studies designed to learn more about the properties of a drug and identify tissues and organs that are sensitive to actions of the drug. So testing at least 2 animal species is required by law. After successful completion of animal studies and investigational new drugs like clinical trials in humans. So clinical trials in phase 1, new drug is tested in healthy volunteers. In phase 2, it's performed in homogeneous populations. So during the phase 1, the new drug is to determine safe doses and assess the safety of it. In phase 2, performed in homogeneous population of patients. Usually about 50 to 300 patients are evaluated and designed to evaluate efficacy and safety. Establishes which form is most effective. So you may get many different milligrams or strengths of the drug and use it on different volunteers. In phase 3, the drug is made available to a larger group of patients. Usually several thousand patients. Studies usually last several years. Evaluate efficacy and monitor the nature and incidence of side effects that may occur. Phase 4, application to the FDA for approval to market the drug. Compares new drug with others on the market and examines long-term efficacy and cost effectiveness. So as you can tell, there is a long process for these drugs to get approved by the FDA. All right, drug containers should be guarded against possible theft. So it usually requires the boxes to be locked, secure within the AEMT. There should be policy guide manner in which drugs are secured, stored, distributed, and accounted for. The controlled substances such as narcotics are administered. Records must be kept separate from other paperwork. So the DEA strictly regulates these substances. If drugs are lost or stolen, the supervisor and law enforcement personnel must be notified immediately. And expired control medications must be destroyed and usually has to be written by somebody from the DEA, they usually come down to your service and try to do this. So we do keep records separate, and when they are administered, um, it's a whole different kind of paperwork. Drug containers should be guarded against possible theft. That's why we have to keep padlock boxes on the trucks, and usually the trucks will be locked most of the time. And also inside the bases, there's usually at least 2 locked doors before you can get to that safe or the storage box. All right, potency of medications is affected by temperature, light, moisture, the shelf life itself, exposure to the air. So depending on the drug, you have to keep it within so many degrees of Fahrenheit. There's a range there. Some drugs are light sensitive, and that's why you'll see some drugs in darker brown vials or storage containers. Moisture can affect drugs too. Shelf life. Some drugs that are affected by moisture come in powder to begin with. If that drug gets any moisture in it, it's going to mix it, and so it may be good or may not be good. So shelf life. Some drugs have a particular shelf life that they have to stay before they switched out, and then exposure to air. So. All right, pregnant patients, expected benefits of a drug should be considered against possible risk to the fetus. Ask the patient whether he or she could be pregnant or not. So, prescription OTC drugs have potential to harm fetuses and newborns. Changes in pregnant woman's body affect the way drugs are processed and may increase the chance of harm. Metabolism of drugs in the liver is decreased, increased rate of excretion itself. The FDA has established a scale of categories A, B, C, and D, and X to indicate drugs that have documented problems in animals and or humans during pregnancy. So, there's a table in your book with pregnancy categories for both classification systems. So when in doubt, contact your medical control for further guidance. Be cautious when you're giving drugs to pregnant patients. Make sure that if you're not sure, you call medical control and get some advisement from them also. Pediatric patients, medications have different effects in children. Young infants have reduced metabolic capacity. The incomplete development of the GI tract slows absorption and oral medications and delays elimination from the body. So same medications may be more potent in an infant than an adult, and children can metabolize some medications quicker than adults, and they require relatively higher doses and more frequent administration. All right, geriatric patients. Changes in pharmacokinetics in geriatric patients are comparable to those in young children. So, you have to think about those geriatric patients just like their children sometimes. So hepatic functions GI actively slow and delay absorption and elimination. Often taking several medications, sometimes suitcases full of medications. So, some therapies may interact and modify effects of each medication. So may unintentionally overdose on a particular drug, or they may have forgot they take it. So a lot of times, if they take it straight out of the bottle, they may have forgot they're taking it, or they may not remember exactly how they were prescribed to take that medication. That's why we have the weekly pill dispensers. Sometimes you can use those also, because if they do forget, they'll leave the pills actually in the dispenser on the day they forgot, the day or night, what have you. And then you may know that they didn't take it or they did take it. Or they may have gotten confused, can't remember if they took it, and you may see more out of the dispenser itself than what's supposed to be. And that may give you a quote off. So you are legally, morally, and ethically responsible for each drug you administer. Drug administration must be safe, therapeutic, therapeutically effective. Always keep a field guide or other reference handy. Some people keep those little field guides in their pocket. Some people actually keep protocols. Um, with technology nowadays, you can find a lot of references via on your cell phone to help you. Methods of drug classification are based on the effects drugs will have on a particular part of the body or on a specific condition. Many fall into more than one category, classified into three categories: the body system, class of agent, and their mechanism of action. So, nervous system classification, body principal control system composed of central nervous system and peripheral nervous system, such as your brain and spinal cord. The peripheral nervous system includes all the nervous tissue outside the CNS. Peripheral nervous system contains the autonomic nervous system, and it divided into the sympathetic and parasympathetic nervous system. This is for your fight or flight, adrenergic response, ultimately causes the release of hormones epinephrine or norepinephrine. Parasympathetic nervous system relaxes the body, controls autonomic functions during non-stressful times, so you'll rest and relax. So, hormones released by sympathetic system stimulation act on hormone receptors. So, you have your alpha 1s, alpha 2s, betas, and your beta 1s and beta 2s. This is the four types these receptors respond. Sympathomimetics mimic the effect of the sympathetic nervous system. So it produces hormones. Sympatholytics inhibit the sympathetic nervous system. It's also known as the anti-adrenergics. Antagonists counteract the action of something else. Agonists bind to the receptor and cause a response. Beta blockers used to control blood pressure in some patients and heart rhythm disturbances in others. So a lot of your beta blockers they end in LOL. So you administer drugs that agonize the beta 1 receptors in an attempt to treat cardiac arrest and hypotension. So, and beta 2 selective drugs cause bronchial dilation with little effect on the heart. Parasympathomimetics, agonists to the parasympathetic nervous system, also called cholinergic medications. So, they act directly or indirectly on the cholinergic receptors. If excessive cholinergics are present, the patient may exhibit phlegm symptoms, salivation, sweating, lacrimation, urination, defecation, drooling, diarrhea, gastrointestinal upset and cramp, and emesis, muscle twitching, and myosis. Patients exposed to certain fertilizers, insecticides, VX, and sarin gas may exhibit phlegm symptoms. Parasympathetics, antagonists to the parasympathetic nervous system. Atropine is one of the most commonly used. Also called anticholinergic medications because they block two types of cholinergic receptors. Analgesics, medications that relieve pain and induce analgesia. So opioid agonist, most common classification used for analgesia, similar to or derived from the opium plant. It binds opiate receptors, which prevent neurons from sending pain signals. It's a CNS depressant, so fentanyl is rapid acting, very non-opioid antagonists, agonists. They alter posterior glands through forms of salicylates. An example of that is aspirin. So the aspirin targets the COX-1 enzyme to reduce platelet aggregation. And then you have the NSAIDs like ibuprofen, so they reduce pain, inflammation, and fever. They inhibit the COX-COX enzyme. And then you got your para-aminophenols derivatives, such as acetaminophen, your Tylenol. Opioid antagonists reverse the effects of opioid drugs, such as Narcan. Opioid antagonists have agonistic and antagonistic properties and decrease pain, but do not diminish function of the respiratory system or lead to dependence or addiction. Anti-anxiety, sedative, and hypnotic drugs help a patient sleep through a medical procedure by producing sedation, hypnosis. They include benzodiazepines, that's commonly used to prepare patients for invasive procedures, barbiturates, and non-barbiturate hypnotics. All right, anticonvulsants used to treat seizures, believed to work by inhibiting the influx of sodium into the cell. It decreases the cell's ability to depolarize and propagates the seizure itself. Stimulants exert action by excitation of the central nervous system. They increase excitatory neurotransmitters and decrease inhibitory neurotransmitters. Examples: caffeine, cocaine, prescription, and illicit amphetamines. They increase release of dopamine and norepinephrine to increase wakefulness and awareness. So they increase tachycardia and hypertension, can cause seizures and psychosis, and high doses can increase nervousness, irritability, tremors, headaches. Some people experience withdrawal symptoms when they start taking stimulants. All right, depressants slow brain activity, may be prescribed to treat anxiety, muscle tension, pain, insomnia, stress, panic attacks, and seizures. Some are used as anesthetics, and some examples are Ativan, Valium, Xanax, Ambien. Psychotherapeutic drugs block dopamine receptors in the brain, treat illnesses such as schizophrenia and depression. Some side effects: involuntary movement, tremors, rigidity, muscle contractions, restlessness, changes in breathing and heart rate, orthostatic hypotension, sedation, sexual dysfunction. So depression often treated with selective serotonin reuptake inhibitors, MAOIs, and TCA, tricyclic antidepressants. All right, drugs affect the cardiovascular system, classified according to side effects on specialized cells. Effects on heart categorized as follows: chronotropic, they affect the heart rate; inotropic, they change force and contraction; dromotropic, alter the velocity of conduction and the electricity through the heart. So all side effects can be positive or negative. Cardiac glycosides are derived from plants. and block certain ionic pump cells membranes, which indirectly increases calcium concentration. So they do have a lot of side effects with them. Antiarrhythmic medications can have direct and indirect effects on cardiac tissue, classified according to mode of action. Sodium channel blockers slow conduction through the heart. Negative dromotropic effect. Beta blockers reduce adrenergic stimulation of beta receptors. Potassium channel blockers increase heart contractility. Calcium channel blockers decrease the force of contraction and automaticity, decrease conduction velocity. Antihypertensives, such as diuretics, cause kidneys to remove excess amounts of salt and water in the body, lowers the total fluid volume, and lowers preloaded and decreases stroke volume. Vasodilators act on the smooth muscles of arterioles and veins. Sympathetic blocking agents include beta blockers and adrenergic inhibitors, diminish the effects of the beta stimulation. ACE inhibitors target renin, angiotensin, aldosterone system, and they suppress conversion of the angiotensin 1 to angiotensin 2. Calcium channel blockers have anti-arrhythmic and anti-hypertensive properties. All right, oxygen has any appropriate uses and side effects. So, the use of over-the-counter congestant medications is common during cold and influenza seasons. Patients may take antihistamines during allergic season. People have been known to overdose on pseudoephedrine, antitussive, and antihistamines. So be aware of those during season changes. Many respiratory emergency treatments use symptomatic medications. Stimulation of beta 2 receptors is most beneficial to patients with respiratory emergencies. Xanthine relax smooth muscles of the bronchioles. They stimulate the central nervous system, and caffeine is a well-known xanthine and central nervous system stimulant. Corticosteroids suppress the inflammatory response. All right, Joe's fat the pancreas. A variety of hypoglycemic medications are available. Some act on pancreas directly. Others alter the way insulin is used by the body. From learning, increase insulin secretion from the pancreatic beta cells. Insulin sensitive is increased by oral hypoglycemic agents. Immunosuppressant medications are often prescribed to patients who undergo an organ treatment or have an autoimmune disease. So it's intended to inhibit the body's ability to attack a foreign organ or attack on itself. So it inhibits lymphocytes and the T cells. Vitamins and minerals are necessary substances that allow for normal metabolism, growth, and development and cellular function. Supplements may be taken to replace deficiencies and has a preventative measure. Thiamine is important in a pre-hospital setting, as in converting carbohydrates into energy. People with alcoholism, among others, tend to be deficient in this vitamin. However, we don't see a whole lot of thiamine on the trucks anymore. It is something to be thinking about that your service may use. All right, fluids and electrolytes. Crystalline solutions can be isotonic, hypertonic, and hypotonic. Isotonic, stable medium for administration of medication, and effective fluid and electrolyte replacement. Hypertonic help provide nutrition. Hypotonic, beneficial in dehydration situations, so not hypovolemia though. May also administer colloid solution. All right, drug forms. So that was just a big classification of drugs and a look into what you may be investigating when you get to some patients. So, drug forms are the way the medication comes, and it usually dictates its route of administration. So, it is to ensure proper route of medication, time and effort to release into the bloodstream, and effects on the target organs or body system. So, solid drugs are in capsules, gelatin shells filled with powder or liquid medication. Tablets often contain other materials mixed with the medication in comparison to high pressure. Some dissolve very quickly in small amounts of liquid, but they can be taken sublingually or absorbed rapidly. May be ground into a powder to be absorbed more quickly. Pills are solid drugs that's shaped into a ball or oval to be swallowed. Suppositories inserted into the rectum, so usually not administered by the EMT. All right, liquid drugs are solutions. The liquid mixture are more substances that cannot be separated by filtering or allowing mixture to stand. Can be given by any route. Suspension is medications ground into fine particles and easily distributed throughout a liquid by shaking and stirring. An example of a suspension is activated charcoal. Liquid drugs that include alcohol in their preparation is tinctures, spirits, elixirs, syrups, or mixtures with higher sugar content, and emulsions are mixtures of two liquids that are not mutually soluble. So, middle dose inhalers are military spray canisters used to direct substances through the mouth and into the lungs, commonly used by patients with respiratory illnesses. So, these must be shaken vigorously before the medication is administered. It's commonly used with patients with topical medications applied to the surface of the skin, affected only by the area that it's applied to, such as lotion, creams, and ointments. Calamine lotion is an example. Hydrocortisone is an example of a cream. And Neosporin is the first stage ointment. All right, transcutaneous medications are transdermal, designed to be absorbed through the skin, can affect other areas of the body. However, an example is nitroglycerin and fentanyl. It's usually intended for systemic effects. Gels are semi-liquid substances administered orally through capsules or plastic tubes. Oil glucose is an example of a gel. Gases most often delivered in an operating room. Oxygen is most commonly used when nitrous oxide has an analgesic effect. It's administered by inhaling through a mask and has a euphoric effect also. All right, routes of drug administration are affected by the rate at which the onset of action occurs and may affect the therapeutic response. Enteral drugs are administered along any portion of the gastrointestinal tract. Oral take as long as 1 hour for absorption to occur. Rectal, usually non advanced EMT medication are administered rectally. It could be a possible exception of D50 if allowed by local protocols. Parenteral drugs are administered through any route of the gastrointestinal tract. IV drugs, medications need to be entered the bloodstream immediately. It is the fastest delivery, but cannot be used for all medications. IV drugs reaches the bloodstream through the bone marrow. Patients who are unresponsive have a result of cardiac arrest or extreme shock can get an IV insertion. So most commonly used for children who have difficult IVs. Subcutaneous injection is absorbed more slowly and have longer lasting effects. Not perfect for patients with decreased peripheral perfusion. Intravascular injections are usually absorbed quickly because the muscles are highly vascular. Possible problems damage to the muscle tissue itself, uneven, unreliable absorption. So legal route enters the bloodstream through oral mucosal membranes within minutes. Faster than oral route and protects medications from chemical in the digestive system. So example is nitroptamine. Um, Buccal is similar to sublingual route. Medication is placed between the cheek and gums. Common route for glucose gel. Transcutaneous or transdermal is absorbed through layers of the skin. IM is pushed through the nose through a mucosal atomizer device, what we usually call an atomizer itself. Liquid medications is turned into a spray, such as Narcan. Inhalation drugs or aerosols and drawn into the lungs as the patient breathes. There's nebulized medications, MDIs, meterodose inhalers, forms, aerosols, fine powders, and sprays, such as study medications. Study of metabolism and action of drugs is pharmacokinetics. So, pharmacokinetics, look over once administered drugs go through 4 stages: absorption, distribution, metabolism, and excretion. So, the principles is that the medication dose, route of administration, and clinical status of patients will largely determine the duration and effectiveness of the medication. Onset and peak of the medication is generally related to absorption and distribution. A minimal dose of concentration of the medication must be present at certain sites in the body for clinical effects to occur. So duration of action is generally related to metabolism and elimination. So absorption variables affecting absorption include nature, blood flow, solubility, pH level, drug concentration, the dosage form, route of administration, diffusion, osmosis, filtration. So drug distribution, drug passes freely and quickly out of the vascular space and into the interstitial fluid. So blood flow to the area determined by the amount of a drug reaching a particular part of the body, such as the brain and placenta, are less accessible to certain drugs than others. Biotransformation, chemical alteration that a substance undergoes in the body. Primary organ is the liver itself. Drug elimination is how these drugs are going to be eliminated from the original forms or have metabolites. So organs of excretion are the kidneys, intestines, lungs, salivary glands, mammary glands also. Rate of elimination varies with the amount of drug in the body and the underlying conditions of the excretion organ. So a patient's poor ability to eliminate a drug may lead to an accumulation of the drug if subsequent doses are given, resulting in toxic effects. So you give the drug, but the patient is not able to eliminate it properly, it will have certain toxic effects. So consider for patients in shock and geriatric patients. All right, pharmacodynamics is a way in which the medication produces the response we intended. It also includes factors that may alter our intended response or any side effects unexpected. All right, mechanism of action. Drug must reach its appropriate concentrations at its site itself. Magnitude of response depends on the dose and the time it takes for the drug to travel in the body. Once the medication is bound to the receptor site, it initiates a chemical change that produces the expected effect. So, drug response relationship correlates the amount of medication given and the response it causes. When administering medication, know the onset of action, duration of that drug, and termination of that drug. Once duration and termination of action affect the therapeutic index, ratio of a drug's lethal dose for 50% of the population to its effective dose for 50% of the population. It gives an indication of the medication's margin of safety. Interaction between medications occurs whenever a drug is modified by another prescription medication, herbal or over-the-counter medication, nicotine from cigarette smoking, something in the diet, anything to which the patient is exposed. So there are many variables that influence medication interaction. Be aware of potential interactions of medications that are prescribed to these patients, and those patients may be administered. So you may think about stuff like polypharmacy, patient taking a bunch of medications. A lot of times this happens when patients go to multiple providers, and one provider don't know what the other provider is giving. This is starting to be worked out with the internet work between the providers themselves. Interaction with food or alcohol and warning labels on prescription bottles indicate substances that may cause interaction. Predictable responses, some side effects, any actions of a medication other than desired action. And this may occur when the medication is administered properly or under appropriate circumstances. An adverse condition inadvertently induced in a patient by the treatment. So the example is a urinary tract infection that develops after the insertion of an indwelling catheter. So it results in administration of medication leads to symptoms that mimic naturally occurring disease states. Unpredictable responses, adverse effects that are not anticipated. Most common unpredictable response is allergic reaction. So, how do we reduce medication errors? Use the 10 rights of medication administration. Make sure that you have the right patient, the right medication in your hand when you're fixing to give it. Make sure you know the right dose, whether it be a pediatric patient, an adult patient, or a geriatric patient. Make sure you know how to give that patient its right route. And make sure it's the right time. Right documentation and reporting. Make sure you document those in your report, even if there is an adverse reaction to it. Make sure you report them off to your receiving facility. And so then do the right assessment afterwards, as far as vital signs, SpO2, maybe another AccuCheck, and a pain scale. And make sure that patient understands the right to refuse that medication, the right evaluation of it, and give the patient education on that medication. That way they understand the side effects of it, or the intended therapeutic effects of it. All right, use a current reliable medication resource. Have a partner confirm the volume in a syringe, especially or weight-based medication calculation. You get ready to give a drug. You might not be familiar with it, or you're still young. Ask your partner if it's appropriate. What do you think about me giving this? Is it the right dose, right patient, blah blah. And sometimes that's good to make sure that both of you are on the same page. We're giving it. Evaluate for hypersensitivity before each medication administration. The Institution for Safe Medication Practices has developed a list of medication abbreviations prone to causing error. And an EMT is special allowed to administer or help patients self-administer numerous medications. All right, so you may administer oxygen, oral glucose, glucagon, IV dextrose, intravenous fluids, epinephrine, albuterol, nitrous oxide, Narcan, aspirin. But you may also help your patient self-administer Some drugs are licensed physician gives you a direct order to administer medications and or local medical protocols under which you are working permit you to administer that medication. So the local protocols under which you are working include standard orders for the use of medications in defined situations. That's the only time you'll be able to administer these medications if it is standard protocol or if you call it on medical control. Even then, you need to make sure that yourself and medical control are on the same page as to whether you can or cannot give this medication. So you may want to make sure that medical control understands your level of training and what you are or are not licensed or certified to give locally. All right, this is the end of this chapter. Interfere with with aggregation of platelets. So they do not break down that aggregated platelets. Anticoagulants drugs work against coagulation to prevent the formation of thrombi. Basically, they may be prescribed on long-time basis as a preventative measure. So you need to be aware of anticoagulant use. So particularly if a patient has sustained a traumatic injury, you'll see a lot of this in the geriatric patients, but also your cardiac disease patients. They can prevent life-saving coagulation needed to prevent blood loss. Fibrolytic agents dissolve our thrombus and prevent it from breaking off and entering into the bloodstream. So these are the ones that go in with your thrombus patients, such as strokes, depending on what kind of. That's the chemical makeup. There's some scientist that has a very well precise understanding of what all that means. They would be able to depict that. So the generic name is the methazone, dipropionate, whatever. And then of course you got the trade name, which is usually what we call it by, and that's Fentanyl. So then the official name is that generic name followed by a comma in U.S.